Atamanova, Ukraine Media Center and Ukrinform continues its work. This is the 70th day of our war for freedom, and one of the strongest challenges we have is saving lives of our warriors. So now we'll discuss it with our next speaker. He is Denis Trehub, head of the medical department of the National Guard of Ukraine. Mr. Trehub, you're welcome. Good morning, dear friends. I'll briefly tell you about the medical support for the National Guard of Ukraine. During the martial law wartime with intense combat action, one of the key aspects of combat capacity is medical support of units and their skills of primary medical care as well as further treatment and rehabilitation. Provision of medical support to the personnel has been organized using personnel and tools of the National Guard of Ukraine, interacting with the medical units of the Armed Forces of Ukraine based on the medical facilities of the Ministry of Health of Ukraine, Ministry of Internal Affairs of Ukraine, and Ministry of Defense of Ukraine. The main criteria of timeliness of the required medical care is compliance with so-called 10-1-2 criteria, which means that the paramedical care should be provided within 10 minutes, first aid and first surgery care within 1 hour, but not later than 2 hours from the moment of wounding. This principle of timeliness has been implemented in the National Guard of Ukraine's medical units when providing medical support to service people. Currently, the medical branch of the National Guard of Ukraine, in line with its capacity, has organized provision of medical assistance at the first level, according to NATO standards, as Role 1, which is urgent paramedical care, urgent care and first aid. Secondary, skilled or specialized care, as well as tertiary, which is highly specialized medical care, is ensured at further stages of medical evacuation. That is to say, in mobile hospitals of the Ministry of Defense of Ukraine, in health facilities of the Ministry of Internal Affairs of Ukraine, in oblasts or provinces, and in certain medical facilities of the Ministry of Health of Ukraine, strengthened by groups of medical professionals from the health facilities of the Armed Forces of Ukraine, as well as in the National Guard's medical hospital. As we know from our combat experience, main losses, medical losses in the battlefield, unfortunately happen because of loss of blood. Based on the experience of 2014, we know that the main thing is awareness of the personnel. So I'd like to say that in the units of the National Guard of Ukraine, active role in medical care is played by combat medics who have been trained at the training center of the National Guard of Ukraine using platoon combat medic curriculum implemented with the assistance of the Joint Task Force of Ukraine with our Canadian colleagues, which is a so-called Operation Unifier. Also, starting from 2014, the curriculum for military medical training has been reviewed and modern medical techniques have been included, namely TCCCC. During a long time, servicemen and medics have been trained in tactical medical support, and the expected result is that the personnel will be trained in providing paramedical care, getting skills to quickly and effectively use first aid kit, which each and every service person has, which will enable them to reduce the timeline in providing medical care and reduce the number of deaths of wounded soldiers in combat areas. I would also like to cover medical supplies, which is an important component in the medical support of the National Guard. As a result of governmental decisions to increase funding for the National Guard, the reserve fund money has been used to buy medical tools and property to provide urgent medical care. Also, due to good, well-established cooperation with NGOs, charitable foundations and governmental institutions, a significant number of ambulance cars has been provided, as well as medical tools used by National Guard units in combat areas. So I'd like to thank and express my respect for all volunteers, volunteer organizations, donors, charitable foundations and organizations for their help. We have been cooperating with many of them as long as since 2014, and due to this cooperation, we have clear understanding, and they have everybody has clear understanding of needs of National Guard for medical equipment. Important contribution to medical support for National Guard has been made by international community. Under an agreement between the government of Ukraine and the US administration about humanitarian and economic cooperation, medical equipment has been supplied to provide it to combat medics involved in providing paramedical care. Mobile medical units of the National Guard of Ukraine have achieved their capacity jointly with defense forces, who implement their assignments jointly with medical units of the armed forces of Ukraine. Currently, health facilities of the National Guard of Ukraine have been improving and expanding their areas of activities using new medical equipment which is used to treat our servicemen and to treat other categories of people, including internally displaced persons, and for medical and psychological rehabilitation of wounded people and those people liberated from prison as former prisoners of war who are kept in our medical centers. Also, I would like to draw your attention to the fact that due to proper administration in wartime conditions, laws and regulations have been approved to resolve issues of medical support for servicemen. Namely, servicemen can get medical care in all military medical facilities, irrespective of their subordination, without paying, without any repayment for that medical care between medical units. There are no such settlements between between military units, which was the case before. Also, the procedure has been improved for provision of medical care to servicemen and medical and psychological rehabilitation. We have improved the procedure whereby servicemen are sent to medical facilities located abroad. Summarizing the above, we can say that in wartime conditions, the system of medical support of the National Guard has been working efficiently and effectively. It has been constantly improving, and it has been capable of providing medical support to implement assignments of the National Guard of Ukraine. This is a flexible system, and it can strengthen its tools and forces and to develop its health facilities, both existing facilities, and to create new facilities to be provided with modern medical equipment. That's basically it. Thank you for attention. Dear journalists, you can ask your questions. You're welcome. Please use the microphone. Raise your hand. Please use the microphone. I'm Maria Hanchar from Ukraine Forum. Please tell us, if possible, since 24th of February, how many wounded people, how many servicemen of the National Guard have been wounded, and how many have died? Now, we cannot share those numbers. We do have losses, and significant losses, significant numbers, but I cannot share the precise information. Any more questions? Please, you're welcome. Dear colleagues, do you have any questions? About ambulance cars. What sort of cars do you mean? Are those just usual civilian ambulance cars, or they are somehow upgraded, equipped to use them in the front line, to use them for those cars to have certain armor against bullets? Are they re-equipped somehow? Thank you for your question. Mostly we use ambulance cars which are 4x4, four-wheel cars, which we were using. Unfortunately, currently there is still a shortage of ambulance car, including armored ambulance car. We were not manufacturing them. And now to increase the number, it's very difficult to increase the number of armored ambulance cars. We have been working with our foreign partners, and we use our own capabilities to increase the number of ambulance cars. Thank you. Any more questions? Thank you for finding time and joining us. Thank you for joining us. Dear friends, I'd like to remind you that at 2:30 we'll have Alexander Motizyanek with us, spokesperson of the Ministry of Defense of Ukraine. Colonel Motizyanek will tell us about the situation on the front at this time. Please stay with us.